Center to treat COVID-19 situation as a notified disaster for the purpose of providing assistance under the State Disaster Response Fund. Families of deceased persons to get ex-gratia of 4 lakh rupees. Third lot of evacuees from Iran to land at midnight. First flight to bring back students from Italy heads to Milan later today. Center issued notification regulating the supply and price of masks and hand sanitizers for COVID-19 management. Number of positive cases in India rises to 84. 10 of them have recovered so far. US President Donald Trump declares national emergency in the wake of COVID-19 situation. Ban on European travelers to USA comes into force. Indian Embassy in the US issues advisory for Indian students. Home Minister Amit Shah says the government is aiming to have AIIMS in all the states of the country. Says the objective is to have doctors even in the far-flung areas across the country. And in Rajasthan, 11 people killed, 3 injured in a collision between a trailer truck and a jeep on Balotra-Falodi highway in Jodhpur district. PM Modi condoles the loss of lives. Hello and welcome. You're watching DD India and DD News with me, Munman Bhattacharya. Let's get started with the top story. In a major move, the Union government has announced an ex-gratia of 4 lakh rupees for victims of COVID-19. This will be given out of the State Disaster Relief Fund after certification by appropriate authorities. State governments have also been offered financial assistance for the purchase of essential commodities, upkeep of quarantine facilities, and treatment of infected patients. The Union government is treating COVID-19 as a notified disaster for the purpose of providing assistance under the State Disaster Response Fund. The total number of confirmed cases of a novel coronavirus in the country have risen to 84, which includes the 3 patients in Kerala who recovered from the illness and went home. 7 patients admitted at Delhi's Doordarshan hospital have also been discharged. Earlier on Friday, a 68-year-old female from West Delhi died due to comorbidity. The deceased woman had diabetes and hypertension. She has also tested positive for COVID-19. The woman came in contact with her son, who is the 5th case of coronavirus in Delhi, with a history of travel to Switzerland and Italy between the 5th of February and the 22nd of February. The Union government has taken stringent steps to tackle the reported hoarding and black marketeering of surgical and protective masks, hand sanitizers and gloves. It has invoked Disaster Management Act as well as the Essential Commodities Act to ensure price regulation and availability. State and UT governments have been directed to take necessary steps to ensure sufficient availability of surgical and protective masks, hand sanitizers and gloves at prices not exceeding the printed MRP. They've also been directed to monitor the production and distribution of these items and ensure that hoarding, black marketing and profiteering may not happen. Surgical and protective masks, hand sanitizers and gloves have been categorized as essential commodities up to the 30th of June 2020. The Ministry of Health and Family Welfare have shared guidelines for home quarantine. Let's have a look at the definition of contact. Well, the definition of contact is that a contact is defined as a healthy person that has been in such association with an infected person or a contaminated environment as to have exposed and is therefore at a higher risk of developing disease. He's a person living in the same household as a COVID-19 case, or a person having had direct physical contact with a COVID-19 case, or a person who was in a closed environment or had face-to-face contact with a COVID-19 case at a distance of within 1 meter, including air travel. Home quarantined person should stay in a well ventilated single room, preferably with an attached or separate toilet. Stay away from elderly people and pregnant women. Restrict his or her movement within the house. Under no circumstances attend any social or religious gathering. So those are some of the restrictions that home quarantined people need to follow. Besides that, the public health measures which are to be followed include wash hands as often as possible thoroughly with soap and water or with alcohol-based hand sanitizer. Avoid sharing household items with other people at home. Wear a surgical mask at all the times, and the mask should be changed every 6 to 8 hours and disposed of. Disposable masks are never to be reused. Besides that, used masks should be considered as potentially infected. And if symptoms appear, that is cough, fever, difficulty in breathing, he or she should immediately inform the nearest health center or call this helpline number, which is 011-239-78046. Instructions for the family members are that only an assigned family member should be tasked with taking care of such a person. Avoid shaking the soiled linen or direct contact with skin. Use disposable gloves when cleaning the surfaces or handling soiled linen. Wash hands after removing gloves. Visitors should not be allowed to visit the infected person. In case a person being quarantined becomes symptomatic, all his close contacts will be home quarantined for 14 days till reports of such case turn out to be negative on lab testing. And this is about environmental sanitation. Clean and disinfect frequently touched surfaces in the quarantined person's room daily with 1% sodium hypochlorite solution. That's how you sanitize the environment. Clean and disinfect toilet surfaces daily with regular household bleach solution or phenolic disinfectants. Clean the clothes and other linen used by the person separately using a common household detergent and dry. So these are the guidelines that the government has issued in order to combat novel coronavirus. Meanwhile, the Union Health and Family Welfare Minister Dr. Harshvardhan has said that certain precautions need to be taken while eating food in view of coronavirus. In a tweet, Dr. Harshvardhan said that in times of coronavirus, hygiene in food becomes even more important. Eat food that is clean, hygienically prepared and properly cooked as well. He said that unclean and undercooked food can be a source of infections. Wash hands thoroughly with soap and water. In Uttar Pradesh, so far 11 cases of coronavirus have been detected in the state, giving an insight about state's preparedness to fight coronavirus. Uttar Pradesh Chief Minister has said that isolation wards have been set up in several districts of the state.
10-10 बेड के आइसोलेशन वार्ड कोरोना फ्लू से प्रभावित लोगों के लिए आइसोलेशन वार्ड के रूप में पहले से तैयार किए गए हैं। 24 गवर्नमेंट और प्राइवेट मेडिकल कॉलेजेस में भी आइसोलेशन वार्ड बना करके हम लोग प्रदेश में 1268 बेड के आइसोलेशन वार्ड प्रदेश में अब तक स्थापित कर चुके हैं।
He also said that 5 laboratories have been set up for testing of COVID-19 in the state with the help of the central government, 2 in Lucknow and 1 each in Aligarh, Varanasi and Gorakhpur.
प्रदेश में कुल 11 मरीज कोरोना फ्लू से प्रभावित पाए गए थे, जिनमें 10 का दिल्ली के सफदरजंग में उपचार चल रहा है, 1 का लखनऊ में केजीएमयू में उपचार चल रहा है। 5 लैब हम लोगों ने इसकी जांच के लिए प्रदेश में स्थापित की हैं भारत सरकार के सहयोग से, जिसमें लखनऊ में 2 हैं, एससीपीजीआई और केजीएमयू में, 1 अलीगढ़ में है, 1 बीएचयू में है, 1 गोरखपुर में। पीआरडी मेडिकल कॉलेज के वायरोलॉजी सेंटर को भी इसके लिए तैयार किया गया है।
Meanwhile, in Goa, the Epidemic Diseases Act 1987 has been invoked in the state to ban public gathering to prevent the spread of coronavirus. Briefing media persons after meeting with officials in view of COVID-19, Chief Minister Dr. Pramod Sawant said that Anganwadi and colleges will be closed from Monday to the 31st of March. They can be opened after review. Besides, swimming pools, gyms, movie theatres, spas, boat cruises, casinos, clubs, discos and any closed-doors events won't be allowed. He also appealed to stop religious gatherings. He added that local committees will decide about the Shigmo festival. However, the Class 10 and Class 12 exams will continue. People can call up 104 if any suspect is identified. He also warned that action will be taken for spreading misinformation through social media. The Chief Minister said that thermal scanners will be set up at airport, MPT and railway stations to check all those coming from outside to Goa.
पहले हम एयरपोर्ट पे थर्मल स्कैनर डालेंगे, नेक्स्ट एट द एमपीटी और थर्ड एट द रेलवे स्टेशन पे थर्मल स्कैनर लगाएंगे, यानी कि जो भी बाहर से आता है तो उनका थर्मल स्कैनर से हम चेक करेंगे. अकॉर्डिंग टू द इंस्ट्रक्शंस ऑफ द गवर्नमेंट ऑफ इंडिया, दे हैड इशूड द एडवाइजरी फॉर देयर पीपल, सो दे शुड फॉलो द सेम एडवाइजरी अकॉर्डिंग टू अस. जैसे कि हमने कंपलसरी में डिस्को, पब्स ये चीज़ बंद रहेंगी और हम सबके एडवाइजरी जाएंगे जब तक 31 ऑफ मार्च तक ये एक्टिविटी बंद रहना ही बेहतर है.
The Jammu and Kashmir government is doing all it can to tackle the COVID-19 challenge. Sanitation drives are being conducted in several cities. The Dean of Kashmir University has issued an advisory to all government and private colleges, instructing them to take preventive measures to combat the threat of novel coronavirus. In the advisory, the colleges have been instructed to postpone all seminars, conferences, workshops and events involving large gatherings scheduled this month. Lab testing facility is functional at Sher-e-Kashmir Institute of Medical Sciences, Chura, Srinagar and Government Medical College in Jammu. Besides, surveillance teams have been constituted across all districts to meet any kind of eventuality. UT level control room has been established by NHM, National Health Mission at Nagrota, and divisional level control rooms have also been established which are functional 24/7. Meanwhile, Financial Commissioner, Health and Medical Education Department Atal Dullu today visited different hospitals of Jammu to review the quarantine facilities established for suspected coronavirus cases. International visitors to New Zealand must self-isolate for 14 days upon arrival to help slow the spread of the new coronavirus. That's what Prime Minister of New Zealand, Jacinda Ardern, has said on Saturday. She said the unprecedented and far-reaching measure would come into effect from midnight on Sunday and affect all inbound travellers except those from Pacific Island nations.
As of midnight Sunday, every person entering New Zealand, including returning New Zealand citizens and residents, will be required to enter self-isolation for 14 days. Everybody. The Pacific are exempted from this measure. They are the only ones. Anyone from this country, though, will be required to automatically self-isolate should they exhibit any COVID-19 symptoms upon arrival in New Zealand. All of these restrictions will be reviewed in 16 days' time.
Coronavirus continues to spread across the world, but all countries have geared up and put stiff measures into place to contain its spread. Italy's total shutdown enters its 4th day today. The death toll from coronavirus in the country has jumped in the last 24 hours by 250 to 1,266. The number of COVID-19 infections in Japan increased by 23 to reach 720, according to Japan's health ministry. The majority of confirmed cases stemmed from Japan's northernmost prefecture of Hokkaido, which has 137 confirmed cases and has declared a state of emergency over the situation. The 697 cases of infections on the virus-hit Diamond Princess cruise ship, previously quarantined in Yokohama port, were calculated separately. The death toll in Japan from the virus currently stands at 28, including 7 from the cruise ship, according to the health ministry. The ministry said there are currently 46 patients with severe symptoms and are on ventilators to receive respiratory assistance or have been admitted to intensive care units. The ministry also said that 525 people have been discharged from hospitals after their symptoms improved. South Korea reported more recoveries from the coronavirus than new infections on Saturday for the second day in a row, as a downward trend in daily cases raised hopes that Asia's biggest epidemic outside China may be slowing. The Korea Centers for Disease Control and Prevention recorded 107 new coronavirus cases on Saturday compared with 110 a day earlier, taking the national tally to 8,086. In contrast, 204 patients were released from hospitals where they had been isolated for treatment. South Korean paramedics in Daegu disinfected ambulances as the country reported the number of people recovering from coronavirus exceeded those with new infections. Prime Minister Chung Se-kyun visited Kim Young University, Daegu Dongsan Hospital and encouraged medical staff to continue their work. The Korea Centers for Disease Control and Prevention recorded 107 new coronavirus cases today compared with 110 on Friday. These new cases have taken the national tally to 8,086. Meanwhile, 204 patients were released from hospitals where they had been isolated for treatment. The death toll has risen by 1 to 73. The Democratic-controlled House, with President Donald Trump's support, passed a bill to provide free testing for coronavirus as well as paid sick and family leave, strengthened unemployment insurance and increased food aid to ease the hardship on families. The legislation will be taken up by the Senate next week. Meanwhile, US President Donald Trump announced a national state of emergency, freeing up $50 billion in federal funds for the battle against the fast-spreading coronavirus pandemic. He called on all US states to set up emergency operation centers and said the government was accelerating testing amid criticism about the lack of sufficient test kits nationwide.
To unleash the full power of the federal government in this effort today, I am officially declaring a national emergency. Two very big words. The action I am taking will open up access to up to $50 billion of very important and a large amount of money for states and territories and localities in our shared fight against this disease. In furtherance of the order, I'm urging every state to set up emergency operation centers effective immediately. You're going to be hearing from some of the largest companies and greatest retailers and medical companies in the world. They're standing right behind me and aside of me. I'm also asking every hospital in this country to activate its emergency preparedness plan so that they can meet the needs of Americans everywhere. The hospitals are very engaged. New York and various other places are also very engaged. I just spoke with Governor Cuomo. We had a very good conversation, and we're working very strongly with many states, including New York.
In order to curb the spread of COVID-19, the European Union will launch a €37 billion investment initiative as a measure to cushion the economies from coronavirus shock. EU's executive will also provide member states flexibility on budget deficits and will grant full spending flexibility to Italy, as it has been far most affected country by crisis. EU will also use €1 billion of EU money to guarantee up to €8 billion in loans to virus-hit firms in tourism, retail, transport and other ailing sectors, and will activate a clause in EU fiscal rules to allow suspension of budget commitments by countries most affected by the coronavirus crisis. On to some other news now. Union Home Minister Amit Shah addressed the second convocation of AIIMS in Rishikesh. During the convocation, 250 students were conferred with degrees, whereas 132 students were awarded certificates. The Home Minister congratulated the graduating doctors. Amit Shah hailed the efforts made by the Modi government that have transformed healthcare in the country. It was the Modi government that set the target of opening 157 new medical colleges. 6 AIIMS were set up under the Atal Bihari Vajpayee government, and the aim today is to set up AIIMS in every state.
सत्तावन मेडिकल कॉलेज नए शुरुआत करने की आज घोषणा भी हुई है, स्थापित भी होने लगे, काम भी करने। अटल जी 6 बनाकर गए थे, जिसमें से एक जहां पर आपने शिक्षा दीक्षा प्राप्त की वो ऋषिकेश एम्स है। अटल जी ने उत्तराखंड के लिए बहुत कुछ किया, उत्तराखंड को भी बनाया और ऋषिकेश का एम्स को भी बनाया। मगर ये 6 एम्स थे, आज और 16 एम्स के साथ 22 एम्स का काम चालू कर दिया है और लक्ष्य रखा है हर राज्य में एक एम्स बने। हर राज्य में अगर एक एम्स बनता है तो मुझे भरोसा है कुछ ही सालों में सबसे ज्यादा रिसर्च पेपर फाइल करने वाला कोई देश होगा तो मेरा भारत होगा। अगर ये इंफ्रास्ट्रक्चर खड़ा नहीं करते हैं तो आरोग्य को सुधारने की दिशा में हमारा देश आगे बढ़ने का स्वप्न देखने का हमें कोई अधिकार नहीं।
Union Home Minister also said that demography is an asset for India thanks to PM Modi's vision for the health sector. He said thanks to improved educational facilities, India is fast emerging as a hub for academics, scientists, researchers and doctors.
एक जमाना था कि हम जनसंख्या को बोझ मानते थे। आज मोदी जी ने सिखाया, आज 130 करोड़ लोग हैं, जनसंख्या कम होनी चाहिए, परंतु 130 करोड़ लोग 130 करोड़ का मार्केट भी है। हम मानते थे कि हमारे देश में पढ़ाई लिखाई कम है, आज इस तरह की सोच डेवलप हो रही है। दुनिया में सबसे ज्यादा ग्रेजुएट अगर कहीं है तो भारत में है, सबसे ज्यादा इंजीनियर कहीं है तो भारत में है, और कुछ ही समय में सबसे ज्यादा डॉक्टर कहीं पर होंगे तो भी वो भारत में होंगे, सबसे ज्यादा वैज्ञानिक भी अगर कहीं होंगे तो भारत में होंगे।
Union Health and Family Welfare Minister Dr. Harshvardhan said that Prime Minister Narendra Modi has a vision to see a new India by 2022. Addressing the second convocation ceremony of AIIMS Rishikesh, Harshvardhan said that Prime Minister wants to see smile on the face of every Indian.
You have to keep yourself updated with every recent advancement, because if you don't keep yourself updated, we are fortunate that today we have one of the most dynamic and the great visionary Prime Minister in this country, whom we know and the whole world knows as Prime Minister Narendra Modi. He has a great vision. He is a dreamer, he is a doer, he has a lot of visionary programs. For every visionary program, he has ensured that that visionary program is very meticulously implemented in this country.
Finance Minister Nirmala Sitharaman today chaired the 39th GST Council meeting in New Delhi. Besides Minister of State for Finance Anurag Thakur, the meeting is also being attended by Finance Ministers of states and UTs and senior officers from the Union Government and states. In a tragic incident, at least 11 people were killed and 3 injured after a trailer truck collided with a jeep in Rajasthan's Jodhpur. The accident took place on the Balotra-Falodi highway in Sherga area today. Among the deceased were 6 women, 4 men and a child. Police and rescue teams were on the collision site. A crane was also being used to extract the rest of the bodies from the vehicles. Prime Minister Narendra Modi condoled the accident in Jodhpur. In a tweet, he said, "Deeply saddened to hear of the terrible road accident in Jodhpur, Rajasthan. My heartfelt condolences to family members of those killed. I pray for a quick recovery for those injured." Heavy rains accompanied by hailstorm lashed parts of the national capital on Saturday afternoon. It was a cloudy morning in the national capital with the minimum temperature settling a notch above the season's average at 16.4 degrees Celsius. That's what the Met Department said. Parts of the national capital experienced heavy showers overnight too. The BCCI has suspended all domestic tournaments until further notice as a precautionary measure in the wake of the deadly coronavirus that has been spreading in the country and worldwide at a rapid pace. This comes on the heels of the suspension of IPL 2020 till the 15th of April and cancellation of the remaining 2 ODIs between India and South Africa that were scheduled for the 15th of March and the 18th of March. BCCI on Saturday announced that all matches of the Irani Cup, Senior Women One-Day Knockout Vizzy Trophy, Senior Women One-Day Challenger, Women Under-19 One-Day Knockout, Women's Under-19 T20 League, Super League and Knockout, Women Under-19 T20 Challenger Trophy, Women Under-23 Knockout, Women's Under-23 One-Day Challenger have been put on hold till further notice. And now we leave you with tips to beat COVID-19.
हैंड वॉशिंग बहुत ज़रूरी है, हैंड वॉशिंग करना बहुत ज़रूरी है और हम अच्छी तरह से अपना हाथ धोएं, ये एक बहुत ज़रूरी स्टेप है। रेगुलरली हाथ धोएं, स्पेशली जब हम बाहर से आते हैं, और हाथ धोने की जो तरीका है उसको प्रॉपरली फॉलो करें। अपना हाथ, अपनी हथेली को अच्छी तरह से साबुन से मलें, उसके बाद हथेली के पिछले वाला हिस्सा जो है उसको अच्छी तरह से मलें, उंगलियों के बीच में जो एरिया है उसको अच्छी तरह से मल के देखें। जो नाखून है उसके ऊपर भी साबुन अच्छी तरह से लगना चाहिए दोनों साइड में। फिर जो हमारा अंगूठा है उस पर भी अच्छी तरह से साबुन लगाएं और फिर पीछे पूरे रिस्ट तक हम अच्छी तरह से अपने आप को साबुन से हाथ धोएं। साबुन अगर आपके पास नहीं है और आप ट्रैवल कर रहे हैं तो हैंड सैनिटाइज़र भी यूज़ कर सकते हैं।
And with those tips, we come to the close of this edition of the news. News and updates will continue on DD India and DD News.